Hi there, my name's Dr. Steven Sukin. I'm a urologist in North Houston with a group called Texas Urology Specialists under Texas Oncology. I've been a urologist up in North Houston for over 20 years and did my training here in Houston, Texas at Baylor College of Medicine. One of my passions to be a urologist is treatment of prostate cancer. And over the years, more options have become available to our patients. And so I'd like to talk today about one of the newest options that we have now here in Houston, Texas, called the Tulsa Pro procedure under a company called Profound. For many men diagnosed with prostate cancer, it can be very disheartening to get that diagnosis, not just because of the risk of spread of prostate cancer, but the treatments that we currently have can have significant risks, and those risks can affect quality of life. Certainly, I'm a robotic surgeon, first robotic surgeon in North Houston, over 18 years of experience doing robotic surgery. And for the right patients, a robotic radical prostatectomy is a good way to go. For other men, radiation therapy is an excellent option. But for both of those options, they don't always fit the mold for patients and their quality of life and their type of prostate cancer. And there are other alternatives. Both of those very accepted options of robotic prostatectomies and radiation have had improvements year after year in their quality of care. They can risk loss of sexual function and loss of urinary control, particularly in surgery. And then with radiation, risks of injury in the rectal wall, changes in sexual performance, worsening of urination. So my patients are looking for an alternative. And I'd like to talk about the Tulsa Pro procedure that I've been providing here in Houston, Texas over the last year and a half. I started the first hospital-based Tulsa Pro program in Houston at Methodist Willowbrook Hospital, and that started about a year and a half ago. And the basis of Tulsa Pro is, rather than radiation treatment or surgical removal, it's individualized treatment. We can very much focus the treatment on what's right for the patient. In general, it's best for patients with low to intermediate risk prostate cancer patients. But those patients that are looking for an option that can better preserve urinary control and better preserve sexual function and can individualize their therapy. For example, with both radiation and surgery, they treat the whole prostate. The entire prostate's treated. We've come into a new era where we are using MRI imaging that, with special software, can help identify tumors. And for many men, they may have a tumor that's isolated in one area of the prostate, and that is both localized by the MRI and our biopsies. And so rather than treating the whole prostate, we may be able to successfully treat the focal area of the prostate. And by doing that, we may be able to better preserve sexual function, and we may be able to preserve their urinary control in a way that's more successful for the patient. The Tulsa Pro procedure is FDA approved. It's an ablation treatment. It uses ultrasonic, it uses focused ultrasound and thermal ablation to treat prostate cancer. This treatment is done in an MRI suite. It's done in the radiology department rather than an operating room. We've sort of created a hybrid operating room that has both an MRI there and an anesthesiologist, and the patient's put to sleep in that MRI suite and then placed into the MRI, where we get live MRI feed and imaging throughout the procedure. The procedure requires no incisions. The procedure involves a catheter that is placed before we start the procedure. And this catheter is where the treatment comes from. That catheter is placed into the male urethra. Once that's positioned, the device is secured with a robotic arm. And then the urologist and the radiology team will come just outside the MRI once the patient is safely placed into the MRI. And we will scan the prostate. Once that's done, we'll be able to draw out the boundary lines that the patient and I have discussed in the office in our consultations about the best way to treat that particular patient. For example, some patients may have prostate cancer in all quadrants of the prostate and want the entire prostate treated. And we can do that. And depending on their sexual performance, we can do our very best to create the boundaries away from the neurovascular bundles and preserve sexual function. While it can't be guaranteed, it has some of the best results of any treatment available for sexual preservation. And for many men, this is worth it to them to try an ablative technique to try to preserve their sexual function. Once we've created the prostate ablation, the prostate boundaries, we begin the ablation. Now, this catheter both cools the urethra and also for protection of the rectal wall, which can be a concern with other ablative therapies, we place a rectal probe that also cools the rectal wall throughout the procedure, making this procedure extremely safe. Once we've started the ablation, the system takes over and the device begins to ablate the tissue. And when all 10 levels, or the levels that we've designated to treat the prostate, create a proper thermal temperature, then the urethral catheter and the robotic arm will rotate until the entire area is fully ablated and treated. The actual surgical time or procedural time depends on the size of the prostate. We can individualize this for patients who have cancer of the prostate and ablate their prostate cancer. And we've also used this for enlarged prostate. This is a very successful treatment for enlarged prostate. This ablative treatment not only treats the cancer, but it shrinks the prostate gland by over 90%. And this has really been a life changer for a lot of my patients. So once we finish the procedure, it's outpatient. The patients can actually head home that evening. All of our patients have been able to go home on the day of the procedure. For most of our patients, within 48 hours, they feel like nothing was really done to them. They do have a catheter in place, and depending on the treatment, whether it was focal or we treat the whole prostate, or based on the size of the prostate, we may leave the catheter in anywhere from 7 to 14 days. Our patients have had excellent success in the treatment of their prostate cancers. We will follow the PSA. We will consider at 1 year repeat MRI prostates and repeat biopsies. But the success rate in the ablative treatment has been excellent for my patients. And they have really appreciated this option to try to preserve their sexual function and their urinary control. We have not had any patients who've had injuries between their prostate and rectal walls. This has been extremely safe for our patients. We haven't had any patients with urinary control issues. All of our patients have had preservation of their urinary control. And in my career, it's been just amazing to be a urologist and to have such a high rate of patients that preserve their sexual functions. While we can't guarantee this with any procedure, the preservation of sexual function is so important to patients.